Hi, I'm Patty Corbett Ward, and I would like to welcome you to another Learning Thursdays. As you know, the series was developed to give addiction professionals an opportunity for free learning to help them improve the knowledge, skills, and attitudes they need as they walk into their door to offer prevention, treatment, and recovery services in our state. The presentation you're about to review today is the OASAS Prevention Framework. What's it all about and why is it important? As you can see, we have a number of presenters today. Actually, that's the biggest list of presenters since I've been doing Learning Thursdays. Please note that there are a number of different agencies represented here. OASAS is here. Syracuse School District is here. There is representation from Long Island and also from New York State Ed. So I would like to thank all these presenters for their time and for collaborating with each other to get this presentation done. As well, to make you aware, two of these presenters are calling in from Syracuse, so it did take a lot of coordination for them to make this happen. So ahead of time, I would like to thank them all. And as always, folks, if you have questions, feel free to send them to our mailbox at learningthurs@oasas.ny.gov. All of that being said, I would like to hand it over now to Rebecca Cooper and Barbara Bennett as they start the presentation for you. Thank you for joining us, and ladies, thank you for starting the presentation.
Thank you for joining us for the OASAS Prevention Learning Thursday. My name is Rebecca Cooper, and I work in the Prevention Bureau at OASAS.
My name is Barbara Bennett, and I also work in the Prevention Bureau at OASAS.
So for today's Learning Thursday, our overarching goal is to provide a framework for the OASAS prevention programming throughout the state. And then we will hear from both an upstate and a downstate provider talk about how they're implementing their prevention goals within their communities. The New York State OASAS prevention goals include the reducing the prevalence of substance use and problem gambling, decreasing the negative consequences and costs associated with substance abuse and problem gambling, delaying the initiation of substance use and gambling behaviors among youth, and preventing the escalation of substance use and gambling behaviors. The OASAS framework has guiding principles that are implemented through the Institute of Medicine Intervention Spectrum, which is a positive aspect of mental, emotional, and behavioral health. This allows people to realize their full potential, cope with the stresses of life, work productively, and make meaningful contributions to their communities. MEB disorders, such as depression, conduct disorder, and substance abuse, creates an enormous burden for individuals, their families, and communities. Implementing best practice programs and policies aimed at decreasing risks and increasing the strengths can reduce new cases of MEB disorders and significantly improve the quality of life across the lifespan. OASAS follows this model for prevention that includes 3 different subgroups of targeted populations for interventions. Prevention can be addressed for these 3 subgroups of categorized by risk, which includes universal populations. These target without regard to risk level. An example of a universal is all middle school children or all community members. An example of selected populations are members of subgroups that have elevated risk factors, such as children of substance abusers or school dropout. Indicated populations demonstrate elevated risk levels and initial symptoms of the disorder, though they're currently not diagnosable for this disorder. An example is a child with early behavioral problems, such as early use of a substance. So what does risk and protective framework mean? Over 30 years of research has identified factors that predict the 5 youth problem behaviors: substance use and abuse, delinquency, teen pregnancy, school dropout, and violence. Risk and protective factor focused prevention is grounded in the public health approach of planning, of using database predictors of problem behaviors and positive outcomes. To date, this prevention approach has produced the best research evidence that the risk and protective factors are predictive of youth problem behaviors. Research on evidence-based model programs and practices has shown that reducing risks and increasing protective factors does lead to lower levels of youth problem behaviors. This is the ultimate goal in early intervention in the prevention framework. What are risk factors? Risk factors increase the probability of a problem behavior. There are 19 that have been demonstrated through reliable research. Community. An example of community risk factors include the availability of drugs or alcohol, insufficient laws or policies related to the sale of alcohol or drugs, extreme economic deprivation. Family risk factors can include a history of the behavior in the family, poor family management and conflict. School risk factors can include low commitment to school and academic failure. Peer and individual risk factors include a perceived risk of harm and favorable attitudes towards use, as well as problematic behaviors in elementary school. Protective factors decrease the probability of a problem behavior developing. Examples are opportunities for pro-social involvement and rewards for pro-social involvement that help children and young adults bond with their community, which has been shown to lower their risks for substance use. For families, it's the same involvement. Opportunities to engage with their family in meaningful opportunities and feeling responsibilities of the family will help increase their protective factors. Rewards for pro-social involvement in the family, for example, family members and siblings giving praise for things that are well done by children, is shown to lower the likelihood of engaging in substance abuse and problem behaviors. The belief in moral order, for example, a belief in what's right and wrong, are less likely to use drugs. Young people who demonstrate competent social skills and positive interpersonal relationships are less likely to use drugs and engage in other problem behaviors. So what does the OASAS prevention programming look like on a community level? OASAS currently has 160 providers that they contract with to provide prevention programming both within schools throughout New York State as well as in their local communities. Prevention guidelines driven by OASAS describe the parameters by which prevention services are delivered. It focuses on positive health messaging founded from and evaluated through research. Providers are required to develop a yearly work plan which is descriptive of their planned services in their communities with the goals of decreasing the risk factors for substance abuse and problem gambling and increase the protective factors that support healthy choices. Research shows that the longer kids delay initial use of a substance use disorder or problem gambling, the least likely they are to develop a problem. All planned activities from OASAS providers are developed on what we call a community needs assessment that tells a community what their specific elevated risk factors are and the problem behaviors that will guide the work plan development for them. An important component in the work plan development is the use of evidence-based programs that show substantial evidence of a change in a behavior which will increase the youth or the community's protective factors and decrease their risk factors. Providers are required to report monthly on a monthly service delivery program, and benchmarks are set for specific outcome measures. Providers are required to deliver at least 60% of their services related to an evidence-based program, which are chosen based on the cultural relevancy of the target population and the local identified needs. Now Barbara is going to talk specifically about evidence-based prevention programming.
Thank you, Rebecca. As Rebecca mentioned, I'll be talking about evidence-based programs and specifically conducting a needs assessment to identify an evidence-based program for a community. Choosing an evidence-based program is a data-driven process. An agency or coalition would identify an evidence-based program through conducting a needs assessment. And a needs assessment would consist of survey data, archival data, focus group information, as well as key informant information. It identifies priorities in that community. And through those priorities identified, a community or coalition would choose an evidence-based program that fits their needs. Evidence-based programs can be direct or indirect services. A direct service is often a curricula and session-based program. Some examples of direct EBPs are Life Skills, Strengthening Families, and PAX Good Behavior Game. They are school curricula, often administered in schools or after-school programs, and they also include interventions involving long-term, interpersonal, and ongoing repeated contact, for example, for prevention counseling. Life Skills is a school-based program that can be administered in elementary, middle school, and high schools. Strengthening Families is a family curriculum aimed to develop skills to increase resiliency in school success, family management, and decrease conflict. PAX Good Behavior Game is also a school-based program, and we will hear more about that program later on in our presentation. Community-level services or strategies are considered indirect, and that will include environmental strategies. Environmental strategies provide a three-pronged approach. They include policy, enforcement, and media. All three strategies, or all three components, must be delivered together to achieve change. Later in our presentation, we will hear from providers that deliver and provide technical assistance for environmental strategies. Next, I will be talking about the Prevention Bureau initiatives. The first one up is the Evidence-Based Program Panel Review. This group identifies effective substance abuse prevention programs. They rate the strength of documented evidence, and they maintain a registry of evidence-based programs and strategies. A list of evidence-based programs and strategies can be found on the OASAS website listed below. Panel members from the Evidence-Based Program Panel Review consist of researchers from OASAS as well as providers across New York State. We currently have identified 50 programs that are approved for use, and they are listed on the OASAS website below. The next initiative is the College Environmental Prevention Initiative. It is a 5-year OASAS grant awarded to 20 SUNY and CUNY colleges. They are tasked with creating community coalitions to address underage drinking and drug use using environmental strategies. They also will be expanding SBIRT services, and SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. Specific aims of the College Environmental Prevention Initiative include reducing 30-day alcohol and drug use and binge drinking, decreasing alcohol and other drug-related incidents, increasing alcohol compliance rates, and changing attitudes, beliefs on campus regarding alcohol or other drug use. Our next Prevention Bureau initiative is Problem Gambling Treatment, Prevention, and Recovery. And the goal of this initiative is to raise awareness and expand access to care and provide culturally relevant prevention, treatment, and recovery services. Currently, we have 19 outpatient providers, mostly within chemical dependency programs. 6 ATCs have problem gambling treatment and recovery services. Problem gambling prevention and treatment and recovery initiatives also include the Queen's Center for Excellence, which is a pilot using private practitioners for treatment. It includes the Problem Gambling Training Partnership and the Responsible Play Partnership, which is a partnership with the New York Gaming Commission, the New York Council on Problem Gambling, and OASAS. Its primary goal is to address underage gambling and work with casinos to implement their responsible gambling plan. Next up, we have the New York State Helpline, which is often the first contact someone has with reaching out for help or to OASAS. It's staffed by master's level clinicians and student interns 24 hours a day. The Helpline receives about 30,000 calls and texts a year. They offer a follow-up phone call within 48 hours. Another Prevention Bureau initiative are the Prevention Resource Centers. They offer training and technical assistance in community prevention. They collaborate with the National Guard's Counter-Drug Task Force. They also provide trainings to providers, one of which includes SAPS, or the Substance Abuse Prevention Skills Training, which is a fundamental training. They also provide prevention ethics as a training for providers. The Prevention Resource Center's primary goal is to work with community coalitions to strengthen the prevention infrastructure. The next Prevention Bureau initiative is a pilot program between the New York State Department of Education and OASAS. Later in our presentation, Dr. Laura Ficara and Martha Morrissey from New York State Ed, as well as 2 providers and the Syracuse School District, will be talking more about this MOU pilot program. The pilot program was started in 2016. It runs to June of 2019. It's in elementary schools in 3 public school districts, and it is a prevention provider supported implementation of a universal EBP, the PAX Good Behavior Game. The Regional Addiction Resource Centers, also known as RARCs. There are 10 RARCs across the state. They are developing community action partnerships. They involve populations and services which aren't typically connected to treatment, recovery, and prevention. Regional Addiction Resource Centers are tasked with providing a list of all addiction services in their respective regions. They are developing speaker bureaus, as well as 12 public awareness activities per year, and they also reach out to high-risk populations to connect them with care. They are also tasked with offering 1 media messaging campaign per year, and they are partnering with communities to develop messaging that is appropriate for the regions. Another Prevention Bureau initiative is SAMHSA's Partnership for Success, or also known as PFS. PFS is an environmental prevention initiative to reduce non-medical use of prescription drugs and heroin. There are 10 community coalitions across the state that are using environmental strategies to reduce non-medical use of prescription drugs and heroin among the 12 to 25-year-old population in their communities. It's considered a demonstration project, and it runs for 5 years. Some of the messaging developed by The PFS coalitions include what you're seeing on the screen. Super Parents Supervise. This message appears in local newspapers as well as running in local movie theaters and on transportation. The Prevention Bureau also uses positive messaging that was developed by OASAS years ago. It's on the OASAS website, and the goal is to provide resources and support to parents, community prevention providers, teachers, college administrators, and caregivers in preventing underage drinking and drug use or to delay the onset of use. What you see on the screen is an example of some of the positive messaging that is put out through this campaign. The campaign also has a Facebook page that puts out messaging several times a week. What you see on the screen is an example of a message that went out at Thanksgiving to remind parents to be aware that the night before Thanksgiving is also a night of heavy drinking for people home from college or out of school. That concludes the Prevention Bureau's overview of the services we provide throughout the state. Next, we'll be hearing from two providers from Long Island who will be talking about environmental strategies. Pamela Mitzi from the Long Island Prevention Resource Center and Felicia Skakoza from Riverhead Community Awareness Program.
Hi, I'm Pamela Mitzi.
And I'm Felicia Skakoza.
And we're here to talk about environmental strategies today. First of all, they're not reduce, recycle, reuse, but they are grounded in the field of public health, and they are aimed at changing and maintaining the environments or the context to promote healthy choices. They're typically directed at limiting availability and access to substances of abuse, and the goal is to affect population level change, that is to reach the entire population to reduce collective risk. They can be implemented nationally, for instance, the minimum drinking age laws, at the state level, the alcohol beverage control policies, or here in New York, state liquor authority policies, and locally, for example, smoking in public places. Next. So before we look at specific strategies, we wanted to go over these 7 strategies for community change. Providing information, our educational presentations, workshops, seminars, presentations of data. Then enhancing skills are those workshops and seminars and activities designed to increase skill of participants, members of staff, and needed to achieve population level outcomes. Providing support, creating opportunities to support people to participate in activities that reduce risk or enhance protection. Enhancing access and reducing barriers are just that, improving processes to increase the ability and opportunity to utilize systems and services. Changing consequences is providing incentives or disincentives. Physical design, changing the structure of the built environment to reduce risk or enhance protection. And then finally, most importantly, changing or modifying policies. These are formal or informal changes in written procedures, bylaws, proclamations, rules, or laws with written documentation designed to structure community norms. How are they different from other prevention strategies? They're different because they're directed at the gatekeeper of the environment. Gatekeepers are those people or entities able to block or expand access or control over access to the product. They involve laws, policies, and regulations along with enforcement and media. And they often have consequences, either direct or potential consequences associated with noncompliance. Environmental strategies encourage gatekeepers to become more responsible and better at monitoring access. Gatekeepers gatekeepers can prevent risky decisions. So more examples of environmental strategies, policies, laws, regulations, and procedures, and enforcement. So DUI, driving under the influence, driving while impaired, driving while ability impaired, lower blood alcohol concentration, including zero tolerance for minors, and then high visibility sobriety checkpoints. Under retail access, there's changing the minimum drinking age, limiting hours and days of sales, the density of alcohol outlets within a community, the responsible beverage server training, liability for alcohol sales, compliance checks or purchase attempts, and those two, we'll see examples of these strategies later on in this broadcast. Compliance checks are by law enforcement, and purchase attempts are usually by youth working with law enforcement. So some examples of environmental strategies include social availability. So underage drinking party dispersal, social host ordinances, which are those that prohibit serving alcohol to minors at home, party patrols, and that's when law enforcement has to break up a gathering of youth that are drinking. And then finally, shoulder taps, and that's when an underage person asks you to purchase alcohol for them. Under price, we have changes in taxes and limits on discounts, for example, happy hours. And under promotion, there is public advertising restrictions, alcohol sponsorship restrictions at public events, and then restrictions on alcohol and other drug merchandise sales at public events. Finally, we have changing in community norms, public availability and alcohol use, school substance abuse policies like adding vaping restrictions, school, I said already, workplace substance abuse policies, alcohol use restrictions at public events. Some sports arenas will only sell 2 drinks at a time to a person. And then finally, social norms misperception campaigns to highlight the truth regarding prevalence of use among youth. And those last 2, again, we will see examples further on in this broadcast. And we're not just talking about alcohol here. Environmental strategies can be used around marijuana use. They would be similar to those used for alcohol: taxation, minimum age laws, retail licensing and compliance checks, DWI laws and sobriety checkpoints, and social host liabilities, including dispensary placement and vape store zoning restrictions. For prescription drugs and opioids, you have the limits on prescription amounts and refills, mandatory use and monitoring programs with sanctions for physicians who are out of compliance, and Narcan availability throughout the community, as well as medication take-back events. So here we have a graphic that shows us the relationship between policies, media, and enforcement. And so policies are at the top of the pile, being the most important, and we use them to produce significant behavioral change. And then media and enforcement both support that policy change. Media is important because it alters people's perceptions. It helps with enforcement, and enforcement and media play into each other back and forth. Media gets to target those gatekeepers and focus on their control of availability and access. And for policies to be most effective, they need to be supported by both media and enforcement. Felicia, why don't you show us some examples from Riverhead?
Thanks, Pamela. So here are some examples from Riverhead, New York. Riverhead CAP and the Riverhead Community Coalition for Safe and Drug-Free Youth serve the communities that comprise the Riverhead Central School District on eastern Long Island, an ethnically and economically diverse community of about 41,000 people. We have a very robust and active community coalition. So these are some environmental strategies that we use to address underage drinking and prescription drug abuse. We base these strategies on a comprehensive needs assessment and logic models we developed, as Pam previously described. We use a combination of policies, media, and enforcement to address 4 local conditions. The first local condition was youth accessing alcohol at retail outlets. So some of the environmental strategies that we used to address this was enhancing access or reducing barriers, so the Riverhead Police Department does quarterly compliance checks. We change consequences by providing compliance recognition certificates to retailers with information packets containing resources. We put some permanent banners in the alcohol retailers, and we changed policy in that we partnered with the Riverhead Police Department to formalize a method to conduct 4 compliance checks annually and identify specific times during the year when underage drinking rates were highest. So enforcement was provided through the Riverhead Police Department, who conducted the quarterly enforcement of retail outlets. They also participate with our Riverhead Youth Coalition in doing a sticker shock activity in which our youth put stickers on multi-packs of beer, warning of the consequences of buying the beer for underage drinkers. The Riverhead Police Department sends the press releases to the media in partnership with the coalition, and the coalition promotes this media through our website and social media outlets. So here you have an example of the permanent banner that we placed in some of the retailers in town, and on the right is the press release published through the local media that recognizes the vendors who all passed their compliance checks in this instant. And I have to say, compliance check media is a great way for coalitions and police departments to cross-promote each other. Additional media includes the stickers that we use in Sticker Shock, which we do in English and Spanish. And on the bottom left, we have a video on our website that our youth made talking about the Sticker Shock process. And this video is a great way to make retailers aware of the Sticker Shock program. You can bring the video on an iPad to a retailer to tell them what the program involves and how you want to do it. And finally, we have another piece of media that shows retailers who did not pass their compliance checks. And unfortunately for them, they were arrested for underage sales. So the next problem regarding underage drinking was availability of alcohol at fairs, festivals, and outdoor venues. Our community has a very rich heritage of fairs and festivals. For over 40 years, we've had the Polish Fair, the Riverhead Country Fair, and those traditionally took place in the summer and fall. And during those events, the alcohol open container ban was lifted, and it was pretty much a free-for-all where there was free-flowing alcohol in the streets of the community. Youth told us through our focus groups and our PNA survey that they were able to access alcohol at these events. So some of the things we implemented included providing signage in English and Spanish for alcohol servers and for event barriers. We provided wristbands, ID checkers, tips training. We changed the physical design of the events by requiring enclosed consumption areas. And one of our biggest accomplishments to date was that we helped the town of Riverhead pass their first alcohol policy for fairs and festivals in 2015. And again, the policy was very comprehensive, included requiring tips training, identified what a standard size drink was, required wristbands, number of drinks that were allowed to be purchased at one time, and 1 hour before closing, all alcohol sales have to cease. The Riverhead Town Board and the Town Attorney enforce alcohol policy requirements requiring documentation in obtaining a special events permit, which includes submitting your TIPS training certificates. The Riverhead Police Department conducts enforcement during the event. Coalition members conduct environmental scans, report their concerns to the police department, fair organizers, as well as coalition members at our monthly meeting. And the coalition coordinator sits on fair committees with the police chief to further ensure compliance with the policy. So some of the media and outreach that we've done regarding the alcohol policy for fairs and festivals included letting the media know ahead of the passage of the policy what the proposed rules were going to be so that the community would be aware of them. In addition, the Riverhead Police Department went to all the vendors and retailers prior to the events and let them know about the policy and continued to remind them about the policy prior to the upcoming events. We provide signage for the beer booths in Spanish and English, and we provide certificates for the vendors showing that they've been TIPS trained, which they can hang in their beer booths. We also provide large signage to delineate the barriers of the fairs and festivals, and Riverhead CAP has a copy of the alcohol policy on our website available to the public. So the next local condition related to underage drinking is that youth are accessing alcohol at homes and at house parties. This is the biggest problem in our community and most communities where youth say they are accessing alcohol, most either in their own home or the home of a friend, and they're drinking at their home and the home of a friend, with or without parent permission. So a few of the strategies that we implemented include we started doing a pre-prom red carpet event where students were required to take buses to the prom to limit alcohol access before and during the prom, and no limos were allowed. We also implemented a pre-prom presentation for all students that they were required to attend with their parents, and they could only purchase prom tickets at that event, where we talked about the social host policy at that event and the dangers of underage drinking during prom, graduation, and summer party season. We gave some incentives to the students to attend the events with their parents, where we raffled off 4 sets of prom tickets. We took professional photos at the red carpet event and made them available for parents to download, and we gave away swag bags, and we had vendor deals at the events for the prom. And the last thing we implemented was a policy change, and policies were implemented regarding the pre-prom event, and parents were required to sign the social host law addendum in the prom contract. This was a great way to leverage OASAS funding. We paid our staff using OASAS funding, but we got the hospital to underwrite the event and give away some of the prom tickets and some of the giveaways. And it was a great partnership between the coalition, the local hospital, law enforcement, and the school. So some of the ways this is enforced is that the Riverhead Police Department conducts enforcement of the social host law in the community. The coalition provided prior training for the Riverhead Police Department on social host law and party patrols, and the Riverhead School District enforced pre-prom event attendance and contract signature policies. So some of the media that we used was we utilized the media to talk about the red carpet event and what a great community event it was. Our youth coalition did a presentation to the town board about underage drinking and the social host law, in which was covered by the local papers. Our youth does public service announcements at the local radio station, and they focus on the social host law and underage drinking at house parties. And another form of media that we use are these napkins that we give to the ice cream shops in the summer, and the napkins say, "Cool parents serve ice cream, not alcohol, be cool." So media isn't always a newspaper or a digital publication. Media can include flyers, in this case napkins, and then we publicize the use of the napkins on our social media page. The red carpet again, the red carpet event was covered by the papers, and the hospital took out a full-page ad promoting the event. And my favorite is this Donna Reed graphic that we use. We have it a full-page ad in the newspaper. We've put it in the homecoming journal. We've done bookmarks. That ad is very popular. So the last local condition I'm going to talk about today involves prescription drug abuse. So our data told us that there were prescription drugs available in the community, and we did a survey of community members and we found there were barriers to proper medication disposal. In fact, we only had about 2 times a year take-back days when we partnered with the DEA in the local hospital. So some of the environmental strategies we used to address this was we put a permanent drop box in the Riverhead Police Department, which is available 24 hours a day, 7 days a week, and we set up a schedule to do 4 to 6 drive-up take-back events per year. We do take-back road trips at the senior center communities as well. We give incentives at the take-back days for community members that bring their medication, and we formalize the number of take-back events and the methods and the disposal of the prescription drugs collected with the Riverhead Police Department. Again, the police department conducts all medication take-back events and maintains the drop box, but we partner with our local hospital, the Town of Riverhead Highway Department, our senior communities, and our local outlets to host drive-up events. And our Riverhead Youth Coalition, National Guard, and Coalition volunteers participate in the take-back event and distribute the incentives. Some of the ways we publicize medication safety and take-back events, as well as the drop box, include advertising in the newspaper and the 55 Plus magazine that comes out once a year with the newspaper. We also advertise in what's called a Val Pack. Lots of people get these in their mailbox once a month, and the senior citizens in particular love the Val Pack. It has all kinds of coupons in it, and if they bring the Val Pack ad with them to the take-back day, they get a special incentives. And the newspaper reports on how many pounds of medication we collect. We also do flyers in English and Spanish. The National Guard translate these flyers to us that we drop off at locations throughout town, including pharmacies, doctor's offices, and we have collected over 4,500 pounds of medication to date. So these are some of our outcomes. So the first outcome is regards to underage drinking and compliance checks. So prior to 2014, compliance checks were done quite irregularly, mainly when there was a complaint in the community. So now we do them quarterly, and we've had multiple times where our retailers have reached 100% compliance. In fact, 3 times in 2017. And we have a 400% increase in compliance checks overall. The next outcome has to do with fairs and festivals. So our environmental scans told us that the fair vendors were not properly trained in tips, so we began providing tips training for all vendors at fairs and festivals, and it's now a requirement according to the town's alcohol policy. So since 2015, we have done 8 sessions of tips training, and we've successfully trained 113 people. We had a 100% pass rate, and that is good for 3 years for each person. Again, regarding fairs and festivals, our scans showed us in 2016 that 100% of servers were observed checking identification, and all attendees were observed wearing wristbands that were drinking alcohol. In regards to our social host interventions, Riverhead youth who reported getting alcohol at home with parent permission declined by 19% overall in grades 8, 10, and 12. And finally, as I said previously, we've collected over 4,500 pounds of medication, and we've disposed of it since August of 2014. We've had over 20 take-back events since then as well, in addition to our permanent drop box, and our 12th grade 30-day use for narcotics has significantly declined. That wraps up our in-depth look at environmental strategies.
Thanks, Felicia. Next up, we'll have Martha and Laura continuing this discussion.
Another facet of substance abuse prevention through use of the evidence-based programs that were discussed earlier is collaborative efforts for the mental, emotional, behavioral, MEB health. In this section, we'll be talking about a collaborative endeavor between OASAS and the State Education Department. This work involves local partnerships, and we'd like to highlight the work of Syracuse City School District and Contact Community Services as an OASAS prevention provider. Speaking from Contact Community Services, later in the segment will be Susan Van Camp, Director of School Support Services. On behalf of Syracuse City School District, later we'll hear from Melissa Evans, the Director of Student Support Services. I am Laura Ficara. I work at OASAS in the Bureau of Prevention Services. I am the liaison between OASAS and the State Education Department.
Hi, and my name is Martha Morrissey. I'm from the New York State Education Department Office of Student Support Services. Tenets of purposeful collaborative planning. Perhaps one of the most important things when working with other stakeholders is to work within a framework that provides focus and organization to your collaborative work, such as our understanding and our work with OASAS and Laura. One such framework we used was the Center for Disease Control and Prevention's collaborative planning framework right here on this slide. If you look at the orange arrows on the left-hand side, it really outlines the major components of developing and working together in a strategic partnership, which is the first bullet. The second slide is investing in the programs. Are there resources, in-kind resources, monetary resources to help assist moving the program along, as there was with OASAS? Fostering a collaborative culture, making sure the language is common between such as our both agencies. Marketing the program to stakeholders, which is very important, and also measuring progress, not necessarily participation. So is the progress that you're having with your collaborative partners, is it moving along?
One of the benefits of this partnership with State Ed, and there certainly are many, is that we have the opportunity to address both risk and protective factors really at multiple levels. So in the prevention field, we heed credence to the notion that there are risk and protective factors at many levels, being community, family, school, as well as individual and peer. And so whereas some people will think, well, working with State Ed, certainly you get to address the school dimension of risk and protective factors, but really at this point, we need to think about that schools house students and peers that are part of families that come from various communities. And so when we think about risk and protective factor as influences that can hinder or promote healthy development respectively, it is really important that our prevention efforts do occur at the school level. And indeed, roughly 85% of our prevention services are offered within schools.
Schools as prevention partners. That is a perfect slide segue into many of the initiatives that the State Education Department has promoted and done, and also in partnership with our OASAS partners. New York State Dignity for All Students Act, otherwise referred to as DASA, was in 2010, followed by cyberbullying in 2012, legislatively driven. That is our discussion, our initiative on preventing bullying, harassment, and discrimination. Social and emotional development and learning. The State Education Department did have a document completed in 2011, a guidance document. Currently, in 2018, we are planning on release of an updated one for the field. Mental Emotional Behavioral Prevention Policy Academy, which was a wonderful initiative that OASAS invited the State Education to be part of. SAMHSA in 2012 identified identified 7 states in New York State, one of which was New York State, which was an honor for OASAS to receive that, to participate in an initiative, and of course we were honored as well to be chosen to work with them as an education department. The Education Department also has expanded learning opportunities for students to lengthen the school day. Mental health education and law, as many people may be aware of, as July 1, 2018, schools will need to instruct on the multi-dimensions of mental health within health curricula in grades K through 12 as part of the larger construct of wellness. We have developed in partnership with the Office of Mental Health, the Mental Health Association, OASAS, a Mental Health Advisory Council to guide this work. And guidance are expected to be sent to the field very shortly to help promote that initiative. And then in another New York State legislation in June 2014, continued to solidify our partnership and our relationship with OASAS by providing schools with direction, updating their health and education curriculum, relating specifically to heroin and opioids. Modernization of the health education curriculum is what we refer to it as. On the left-hand side, you can see the memo that went out from the State Education Department promoting this legislation and basically explaining to schools that they do need to update their curriculum based on heroin and opioids. On the next slide, we see that on the left-hand side, we have our guidance document for achieving the New York State Standards in Health Education, which was developed a few years ago, but in support of Health Education Modernization Guide. This guidance document, you can see, was actually developed to help students and schools and teachers understand the functional knowledge and assessment that occurs in schools for students to learn about such instruction. And of course, we go back to prevention. The next few pages will outline some of our school health web pages and where these resources can be found. Here we have the Student Support Services website from the New York State Education Department. That's the office I represent. And you can also see on this website there are as many initiatives and proposals and guidance that we have just discussed. And as well, our partners in curriculum instruction at the State Education Department, this is their website where their school health education information does reside. Our New York State Center for School Health is a contracted vendor of the State Education Department. Their purpose is to help us coordinate school health across the state. Their target audience are school nurses, school medical directors, school health educators, health coordinators, and teachers in schools, in the elementary schools that teach health education. In the center, you'll see our health information portal that we welcome anyone to sign up to receive all this listserv information. Also, this portal does serve our pupil personnel services folks. On the left-hand side, you'll see the Youth Risk Behavior Survey. We have a small grant through CDC that the center does implement and administer the Youth Risk Behavior Survey for us. And this is an example of an infographic. And there's also a second side to the infographic, which is available on this website for anyone to use. On the right-hand side, you'll notice the School Health Profiles, which is another CDC grant-funded opportunity that the School Health Services Center does issue to about over 700 schools throughout the state, with the school health principal and the health education professionals filling that information out.
And in addition to the resources that Martha described, on the left-hand side you see a memo that went out to the field, and it really is groundbreaking in that it's a 3-commissioner letter, the commissioners being from the State Education Department, Department of Health, and OASAS, really encouraging teachers to use the kitchen table toolkit. And you may have heard about the kitchen table toolkit, and it really is a developmentally sensitive resource that allows teachers, parents, school coaches to really have conversations with students about substances, and namely from a prevention standpoint. OASAS also has the Combat Heroin and Prescription Drug Abuse campaign. We've got Combat Addiction, and also I want to highlight Talk to Prevent. So from a prevention standpoint, Talk to Prevent is a campaign, but really a resource that has discussion starters and information for parents. However, also teachers can use these resources to really help students develop the protective factors we talked about earlier that will be key in staving off substance use. Another resource that we've been able to put together as a result of our partnership with the State Education Department is Mental, Emotional, and Behavioral MEB Health Indicator data. These data live on the QUIC website, the Kids Wellbeing Indicator Clearinghouse website, which is maintained by the New York State Council on Children and Families. With this information, what we've been able to do is to aggregate conceptually some risk factors that may be in existence for some of our students and youth. Specifically, we gathered information on free and reduced price lunch as a proxy for socioeconomic status, the percentage of students scoring in the non-proficient range on the math assessment in grade 3, the percentage of students scoring in the non-proficient range as third graders in ELA, English Language Arts. We collected information about the percentage of students with an MEB disability code, and from an educational standpoint, we really operationalized that as students with learning disabilities, intellectual disabilities, emotional and behavioral disorders, autism spectrum disorders, multiple disabilities, as well as other health impairment to capture students with ADD, ADHD. Finally, we collected information about the rate of disciplinary events for students with one of those MEB disability codes. The idea behind this information is that prevention providers can use the information on the website as part of a needs assessment to make sure that their services are responsive to local needs. And indeed, once again, based on our partnership with State Ed, we have several years worth of data now on that website that really gets to the county and school district level for each of these indicators. One of the most exciting facets of our partnership between OASAS and the State Education Department is a pilot program that we are running for 3 consecutive school years. And the goal of the pilot program is to, over time, decrease MEB conditions for students. Right now, the pilot program is being completed in 3 school districts across the state, various schools within those districts, and each of those 3 districts were able to select an EBP that had effects on both substance use prevention outcomes as well as mental health outcomes. As part of this structure within the pilot program, the classroom teacher is responsible for delivering the evidence-based program. However, it's the OASAS Prevention Provider Network, very importantly, that serves as the coaching and technical assistance source to help the teacher to implement the EBP that they've selected with fidelity.
You know, Laura, when we talk about coordinating school health and coordinating school services, this is probably a stellar example of coordinating our services at the state level in prevention providing.
Yes, and Martha, I couldn't agree more. And I think making sure that these decisions and the structure really reflect best practice. As we know, research suggests when teachers attend a training, 0% of the information really gets translated into their everyday practice, their pedagogy. But with the coaching and technical assistance and feedback, the percentage goes up to 95% of what teachers learn then gets to be part of their daily structure and routine. So I think the partnership at the state level and certainly at the local level reflects best practice and also helps us to implement programming that's best for students.
And evidence-based.
Yes, so thank you for the opportunity to do this work. One example of an EBP that has effects on both substance abuse prevention outcomes as well as mental health is PAX Good Behavior Game, otherwise known as PAX. PAX Good Behavior Game isn't a program in that it doesn't have a curriculum by way of scripted lessons. In fact, one of the facets that makes PAX so attractive to classroom teachers is that it doesn't take any more class time per se. Because really with PAX what we're doing is we are assisting teachers in developing evidence-based strategies that they can then incorporate into their classroom structure and their routines. Those evidence-based practices culminate into playing a game, so to speak. It's not a game that takes away from class time. In fact, it is a game that involves students practicing self-regulation for increasing periods of time, so that by the end of the school year we really start to see an increase in the number of minutes that students can self-regulate, even at the elementary level. On the right-hand side, you see some short-term and long-term outcomes that have been associated with PAX Good Behavior Game. We certainly see substance abuse prevention outcomes, and some studies suggest that these effects see students through follow-up at ages 19 through 21. So we are seeing very impressive outcomes there. One of the partnerships that I would like to highlight as part of the work with the State Education Department and as part of the pilot program is the work of Syracuse City School District, who has selected PAX to be an evidence-based program as part of their elementary regimen. And in Syracuse City School District, Contact Community Services supports that implementation through the coaching and the technical assistance piece that we mentioned earlier. So right now, what I'd like to do is to have us hear from Melissa Evans, who is the Director of Student Support Syracuse in the Student Support Services, Director of in Syracuse City Schools. Melissa.
You are about to view a video of the PAX Good Behavior Game in action within the Syracuse City School District.
So we start with structure, and whereas PAX, it provides that structure. It's a nice foundation for it. And after you get the structure and for them to be able to, function in a classroom, then they can take in the academics. So you kind of need like that baseline first.
Always having a new program can sometimes be difficult, but it worked right into everything that we were already doing. Using PAX sticks, which are just pulling out sticks, something that you think is so easy, but it means a lot to the kids, random choosing. So it's just good classroom practices.
The whole idea with the PAX Good Behavior Game is that we're giving teachers an hour to 2 hours more of engaged learning and more teacher time for implementing their curriculum. So that's really the foundation. That's teaching children self-regulation, really the same way that you would use strategies to teach children math and science. So they're doing that with behavior without losing time from curriculum. The take-home is really that the PAX Good Behavior Game is about teaching children to self-regulate in the classroom and outside of the classroom. And it is not taking away from curriculum, it's allowing teachers to implement behavior strategies into everything that they're doing throughout the school day so that students can have that engaged learning. And the long-term effects, if students can self-regulate, they're not going to have coping mechanisms that are dangerous, such as alcohol and substance use.
What we were looking for at Porter was a way to really set a very specific standard for what our expectations were in the classroom in terms of behavior and working together. But we also were looking for a way to bring some joy back into what we call school. So when we looked at some of the research-based programs that were out there, PAX really just stood out as the only option. And so we implemented PAX over at Porter. We saw some great gains, and when the district asked me to transfer over to Fraser, one of the things I knew I had to bring with me was PAX. And we have seen a significant decrease in our disciplinary incidents here at Fraser. When we compare ourselves to the same time period from last year, we have reduced our number of referrals by over 2,000. So, and as you can see, just the feeling in the building is a lot more calm than it was last year. Kids are happier, staff attendance is up, which is another measure for me about how well we're doing as a school. And I really attribute that to the foundation that PAX allows you to set collaboratively with your scholars. PAX helps you set those standards and expectations and behavioral routines and things like that, but at the same time it makes school fun. You know, and I would think that the teachers would support me on that, because you see a change in the staff when you bring something like PAX in too, because there's less yelling, there's less reminding students about negative behaviors. It's more about praising the positive and using your classroom community to lift everyone up. We know that PAX is something that we need to continue to weave into the fabric of Fraser School.
We are going to play Pirates. When we play Pirates,
the end prize is it's an intrinsic prize. It's called the Granny's Wacky Prize, where you will do a reward for like a minute or maybe like 28 seconds. They really seem to really enjoy that. And then at other times we'll go to the Granny's Wacky Prize and we'll brainstorm ideas of what other prizes we could put in the bag. And then you go and you pull out. And usually if there are things that they want to do that they put in the bag, they're working even harder for it because it was their ideas.
let's do Pirate. Arg! Arg! Seasick! Shark! 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 Swim! 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 Land ho! Land ho!
The goal, or part of the goal that I appreciate from PAC, is as much as the student management component, but the self-regulation component, because that's a life skill. When students learn that, one, I have to maintain myself in the learning environment, I have to work collaboratively with my peers in the learning environment, that's a life skill. Teachers who have experience with PACs have said it changes the entire school. So Meacham has been a PAC school all along. And that was one of the things the principal from Meacham shared with me, that they could see that transition in their building from students going from K all the way to 5. And so rather than focusing just on the lower grades, they made their building an entire PAC school. So behaviorally, what we're seeing with our students who are engaged with PACs is that this particular year, we've had 0 office referrals. And that number has declined. Last year we had 7. The year before we had 17. The year before that it was 200 and something, and prior to that was 350 something. So we've gone from over 300 to 0. And it's because we're teaching children how to manage themselves. And I think that's the best testimony for PACs, that once we begin to change the individual child within themselves, and they learn now and when can I do this? You ultimately change the behaviors you see. They know that they will be heard, they will be seen, they'll be spoken to, their needs will be met, but time and place.
This is a very trauma-informed approach on dealing with behavior, which means using a harmonica instead of using a high voice will be less triggering to a student that's maybe had trauma where there's been yelling or disruption in their life before. So the non-emotional response to talking about the behavior is really important, and also not calling a student out when a student has made a mistake. I think that's one of the biggest pieces, is students are learning that it's okay to make mistakes. PACS works because it's an evidence-based, trauma-informed approach that gets student buy-in and teacher buy-in.
So it teaches children that critical skill of self-regulation, of time and place, for long-term success. So the little piece is I sit still in my seat for 5 minutes as a first grader, but it ultimately means I can sit in a 3-hour lecture when I go to college.
We would not be able to make the gains that we have made behaviorally, academically, socially, especially in terms of the climate and culture of this building, if we did not have PACS and the support of Contact and OASAS. So we're really, really thankful for all the opportunities that have been presented to us, but we know that PACS is something that we need to continue to weave into the fabric of Fraser School.
You have just seen how PACS works in the Syracuse City School District from the perspective of administrators, teachers, and students. The next slide speaks to how PAX Good Behavior Game has really allowed for teachers in the Syracuse City School District to focus more on the positive behaviors of students in a way that really increases their ability to self-regulate, thus creating more peaceful, productive, and positive classroom environments. When classrooms are PAX peace, then learning takes place at a higher rate and students' needs are better met. This was evidenced in each of the 8 schools within the Syracuse City School District that use PAX, and the highlights of their success are noted in the next slide, to be shared by Susan Van Camp of Contact.
In partnership with the Syracuse City School District, Contact's OASAS prevention providers provide support to 8 elementary schools within the district in a total of 102 classrooms. Of these 8, 6 are currently a part of the New York State Ed Department OASAS pilot program. These prevention providers, called PAX partners, work directly with the teachers in their classrooms daily. Their primary role is to foster positive relationships and model PAX. Partnering leads to high-quality implementation and greater fidelity to the model. PAX partners currently work with 112 teachers in the Syracuse City School District. Better implementation leads to improved outcomes for students and teachers. Currently, there are over 2,500 students receiving PAX in the Syracuse City School District. When implemented consistently and with fidelity, students receive an additional 1 to 2 hours of increased learning time. Over the course of one school year, it is anticipated that PAX partners will provide 5,500 visits to these 112 teachers, visiting each teacher 1 to 2 times per week. Partnering allows teachers to practice the skills they're learning and receive feedback and support. PAX partners facilitate quarterly grade-level data meetings at all 8 schools to review data and set PAX-specific goals. Building administrators also attend each data meeting as they play a vital role to the success of PAX in their building. PAX partners collect classroom data by observing students. From September through June, they track off-task behaviors by students known as spleens. PAX partners also collect scoreboards from teachers to track on-task behaviors, as evidenced by increasing the length of time a game is played. In the 2016-17 school year, 85% of students were successful in playing the game, and there was a 71% reduction in disruptive behaviors, or spleens. The Syracuse City School District also collects data related to the number of disciplinary referrals, out-of-school suspensions, and in-school suspensions. Comparing the 2015-16 school year to the 2016-17 school year, there was a 62% decrease in referrals, a 65% decrease in out-of-school suspensions, and an 85% decrease in in-school suspensions. We had the wonderful opportunity to host a visit from OASAS Commissioner Gonzalez Sanchez in April of 2017 at one of our Syracuse K-8 schools. The commissioner was able to see PAX in action in the classroom. As you saw in the video, the commissioner saw firsthand how teachers flexibly apply PAX in multiple contexts and situations, and most importantly, how much students enjoy having PAX embedded into their classroom instruction. Through the collaboration of New York State Ed Department, OASAS, Syracuse City School District, and Contact, we have advanced the mental, emotional, and behavioral outcomes of students. We had the opportunity to highlight the progression and first-year outcomes of this partnership to 2 commissioners this past January, New York State Ed Commissioner Elia and Commissioner Gonzalez Sanchez. Principal Meekum, who you just saw in the video, recognized the immediate and long-term effects of PAX on students, teachers, and the school culture and climate. Trusting his leadership savvy, he decided to implement PAX school-wide, the first known K-8 school in New York State. Through our collaborative efforts to implement PAX in Syracuse, we had advanced the mental, emotional, and behavioral outcomes for students. In addition, we have also moved the needle on academic achievement. When comparing PAX schools to non-PAX schools, those schools that are implementing PAX actualize a 5% higher rate in academic achievement in reading based on the local reading assessments. And now I'd like to turn attention back to Martha Morrissey from the New York State Education Department to offer some important disclaimer information and reminders.
Thank you, Susan and Melissa. It was very informative. Laura and I, this is one of our favorite pictures of all times. It just reminds all of us why we're here. We're here for the students. We're here to help prevention efforts, and we're here to help them make healthy choices. And I think that's something we've always been on board with, even before our solid partnership. This slide is also a reminder that the information contained here is for guidance purposes only. We know that New York State is a local school district, is a local level school district. They have their own decision-making power and authority, but please feel free to use this guidance and tools here as consistent with local community values.
So we really appreciate you viewing this Learning Thursday session about prevention. It's a very, very important topic on the continuum of services that OASAS providers offer. Certainly today you heard highlights about a statewide collaboration that has led to local level programming for student benefit. And Martha, I want to thank you once again for allowing the opportunity for this programming to happen and really for your ongoing commitment to prevention in so many ways. Thank you.
Oh, thank you, Laura. And thank you to OASAS and for the State Education Department. And please use this model in your local level school districts, your areas to serve the wonderful students that we do.
Absolutely, and these partnerships really develop the capacity of teachers as well as prevention providers. On the screen you see our contact information by way of email. All of the presenters for this Learning Thursday session are listed. Please reach out to us if any questions arise, and thank you for the great work that you do every day. I'd like to turn over the presentation to Patty, who will offer more information about how to complete the evaluation for this Learning Thursday session. Thank you for joining us.
All right, folks, I would like to thank you all for participating today in Learning Thursdays. And to you who joined us, I would like to thank you again for joining us. And please recognize that your feedback is appreciated, and we do take it to heart. It's one way for us to gauge if we are meeting the educational and professional development and needs of the workforce. If you have a moment, please feel free to take the SurveyMonkey at the link noted on this slide. As always, thank you for joining us. Thank you to the presenters again. And thank you to the staff at Media Services. They always put in a lot of effort to make sure that what you receive is a well-polished product. Thank you all, and see you again. Bye now.